We all have a variably shaped organ called the thyroid gland in the front of our neck. This marvelous gland produces thyroid hormones, which control metabolism. Though we doctors are glad to study this fantastic gland and its functions, sometimes it makes things difficult for us, and for you patients too. Hypothyroidism and hyperthyroidism are common thyroid conditions, but having thyroid nodules is even more prevalent. Maybe your doctor has news. You have one or even more thyroid nodules. And you have plenty of doubts. What is a thyroid nodule? It's painful? It's dangerous? Can it lead to cancer? What should I do? Dr. Bandera here, welcome to another video. Today you are going to learn some interesting points about thyroid nodules. But before, if you are a newcomer, don't forget to hit that subscribe button so you can excel when it comes to your health. Thyroid cells, called thyrocytes, make cellular groups forming follicles inside the thyroid gland, a kind of nest of cells. Those cells, for unknown reasons, can sometimes group forming bigger than normal structures called thyroid nodules. Iododeficient areas have more prevalence of thyroid nodules. Thyroid nodules are extremely frequent, especially in midlife and in women. Some necropsy studies, yes, dead people, show that more than 50% of the population have a thyroid nodule at that moment. When you are in your 60s, virtually half of the population have some thyroid nodule. Some years ago, when we did not have so many medical tests, lots of people died with thyroid nodules, and not because thyroid nodules, without even noticing, and nothing happened. Are they painful? The majority of thyroid nodules does not produce any symptoms at all. Only the rare cases of large thyroid nodules can cause some trouble in your throat or problems when swallowing. So, how do I notice I have a thyroid nodule? The chances are that your doctor in a conventional physical exploration noticed your thyroid nodule, or maybe it's you clothing up or looking at the mirror. But more frequently than this, other image tests performed for different reasons, like CT scan or Doppler ultrasound, can display thyroid nodules. Are they dangerous? Good news here. The immense majority of thyroid nodules are benign nodules, which means that won't lead to cancer, or at least the chances of that to happen are meager. But the majority does not mean every single one, and that's the challenge, to distinguish between benign, not to worry about thyroid nodules and the suspicious cancer-carrying thyroid nodules. And how do doctors know the difference? Looking at different factors with the help of image tests like ultrasound, an easy-to-do, non-invasive, non-radiating, and non-expensive test, your doctor can have a precise idea of what kind of nodule we are studying. Those factors are: nodule limits, are clearly or not clearly defined, are there blood vessels inside or at the periphery of the nodule, is there any periphery halo in the nodule, is it similar to the rest of the thyroid gland or not? Does it have calcium inside or not? Is it linked to other pathological lymph nodes? Are there risk factors like childhood radiation or family thyroid cancer cases? Those and other factors will help your doctor to make his or her mind and decide if your nodule needs further analysis. In which case, you probably need a fine needle aspiration biopsy, a punction in your neck that is more impressive than painful, It's performed to analyze the kind of cells the nodule has and differentiate benign cells from dangerous ones. To sum up, if you have one or more than one thyroid nodule, be relaxed. It's commonplace, and the odds to be a cancer-carrying nodule are very low. But your doctor will have to know and perform the necessary tests to rest assured everything is okay. In the best and most probable scenario, your doctor will follow you up periodically with ultrasound tests. And in the worst scenario, if thyroid cancer is diagnosed, you have to know that, depending on the cellular type, is probably the less aggressive cancer of all, and with a well-performed surgery, the chances to be cured entirely are really high. If you want more videos, let me know in the comments. Don't forget subscribing. See you in next video. Stay healthy and strong.